Did you know that over 30,000 Canadians have died due to opioid overdose since 2016? It is a crisis that is affecting communities, families, and plus healthcare system also.
Yeah, I agree with your statement. The closure of safe injection sites in Ontario has sparked the intense debate in the public, as these sites were designed to reduce the harm to prevent the public overdoses of the drugs and to reduce the spread of the infections among the public like HIV/AIDS and hepatitis C, and to connect the people in the healthcare system so that they can save their lives. But the Ontario government has recently announced that they are closing some sites, they are closing some safe injection sites in the Ontario, which
Right.
will have the benefits as well as the impacts on the public health, and public is very concerned about their health and safety due to due to closure of the injection sites.
Right.
Yeah. Do you know, Tejinder, safe injection sites are the facilities where drug abusers can abuse their drugs under the supervision of the medical staff. Why do these sites exist? There are basically three main purposes of these sites, which are designed to where people can abuse their drugs. The first one is providing safe needles, like clean needles. The drug abusers can collect the clean needles and they can abuse the or insert drug to themselves, by which we can reduce the chances of HIV and hepatitis C in our community. The second main reason is they will like these sites offer the medical staff to reverse the overdose immediately if the drug abusers are abusing the drugs on the site and they will have any overdose reaction, then medical staff can help them immediately on the spot and we can save their lives. Okay. And the third main reason is connecting people to the recovery services, like drug addicts can come to our sites and we will provide them the addiction treatment on the sites on the sport, and we can educate them, we can encourage them, we can provide rehabilitation to them to save their lives and for their better future.
This supervised injection site is one of 10 being forced by the province to close by March, now being greenlit to transition into a homelessness and addiction treatment center known as a Heart Hub. The Ford government confirming 9 of the closing sites have been approved for the change, 4 of which are in Toronto. In a release Thursday, Ontario Health Minister Sylvia Jones saying, "We have heard loud and clear from families across Ontario that drug injection sites near schools and childcare centres are making our communities less safe. We are taking the next step in our plan to keep communities safe while improving access to mental health and addiction services." The government investing $378 million over 4 years to fund 19 heart hubs, which will provide many of the same addiction treatment services, minus the supervised use of drugs. This follows the passing of the Safer Streets, Stronger Communities Act and the Community Care and Recovery Act that banned the operation of safe injection sites within 200 meters of a school or a childcare facility.
Studies show that safe injection sites reducing the overdose deaths up to 35%. If it's help, why the government is not like why the government is shutting down the sites? The Ontario government has the different reasons that saves the money of the government, especially. So basically, there's financial reason because the government want to spend more money on the rehabilitation centers, recovery centers, as compared to the drugs, because there are too many centers like near to the schools and the childcare center that expose the children to the drug use. So this is not a safe practice here because it encourage the students and children to use the drugs because they feel like it's safe. So it's not the good thing. And the other is the community complaints about the discarded needles, unwanted products, and the different problems. So they complained again and again. So that's why the government decided to close the safe injection sites that are not good to us, to our community.
Some people agree with closing these sites because they say that instead of helping people recover, these sites normalize addiction and making it easier for people to continue using drugs rather than seeking treatments. Also, concerns have been raised by local business and residents who report an increase in drug abuse and drug related offenses and drug garbages like needles, syringe, and they worry about its impact on public safety and the overall quality of life in their communities.
Yeah, I agree with that.
Yeah, people believe that government funding should go to rehab and mental health programs instead, because they argue that investing in long term recovery services rather than supervised drug use would provide a more effective solution to this crisis.
Exactly.
Yeah, but is shutting down this safe injection site really the solution?
I don't think so.
Let's look at the another side of the debate.
Yeah.
Many healthcare professions argue that shutting down these sites will only make things worse. And here is the reason why. First of all, they prevent overdose death. Medical staff can intervene immediately in case of an overdose, saving lives. Second important thing is they provide access to addiction services. These sites will help connect drug users to treatment program and social services, and social workers can help them. And the last point maybe they reduce the hospital visits. Fewer infections and overdose mean less emergency room stress, so that healthcare system can save money in this term. If these sites close, we might see an overdose, more strain on hospitals, and fewer opportunities for people to seek help.
Okay, now let us see what the Ontario Health Minister has to say on this topic.
Our announcement yesterday was very much focused on we cannot continue to enable drug use in neighborhoods that have schools and daycares. We're going to continue to do the investments that we need, whether it's in addictions treatment beds in Toronto and across Ontario, withdrawal management beds, again in Toronto and across Ontario. But I really want to focus on we are allowing and ensuring that these facilities that have focused on drug treatment, on drug facilitation, are going to get the opportunity to work with multiple organizations to get that supportive housing, to get that healthcare, to get the mental health and addiction support people need so that they get off the addiction.
You know, your announcement yesterday talked about, having these sites move to other locations more than 200 meters away from schools, but, you're not funding the moves of those centers. You also want to stop new consumption sites or other safer supply initiatives. So do you just not believe in them at all and believe that they hold any value in Ontario?
Well, in fact, the existing sites that are adjacent and in the same neighborhoods as the schools and daycare within those 200 meters will have the opportunity to transition into heart hubs, so they don't have to move.
Right, but the heart hubs don't include the option for safe consumption.
Exactly what I was going to say, Molly. So what they do have to do is transition into offering the support out of addictions, offering the support for mental health. I make a comparison of if today you went into a heart hub and you needed support for a mental health issue, you would have that because we have community organizations that are going to come together and transition these organizations.
So, what do you guys think? Should Ontario close the safe injection sites, or is there a better option? Can you tell us?
I think the government should keep the mix. They should invest in the closer safe section, injection sites, and along with that, they have to invest in the rehab programs as well. What do you think?
It's a tough decision, but one thing is clear that lives are at stake.
Yes. So, what do you guys think? Let us know in our comment section. Should Ontario keep this site open or it should be closed? Okay. Thanks a lot, everyone.
Thank you.